Following segment is sponsored by Intermountain Health. March is Colon Cancer Awareness Month. Dr. Priyanka Patel is a gastroenterologist at Intermountain Health, and she's here to show the importance of regular screenings and early detection. Welcome to the show, Doctor.
Thank you for having me. I'm so excited today to talk to everyone about Colon Cancer Awareness Month and getting their colonoscopies done.
Well, I think everyone can say they've been affected by colon cancer, whether they know someone that it's happened to, and it's happening all the time. So really, how common is it from your perspective?
So last year, it was amazing. 150,000 patients were diagnosed with colon cancer, but unfortunately 50,000 passed away from it, and it's definitely a preventable disease. So per day, that's almost 400 patients diagnosed per day.
Yeah, that's a devastating statistic, but thank gosh for you guys that you're here to bring awareness, to get these early detection tests done. Why is awareness about this deadly disease so important?
It's so important because you definitely want to detect it early. So if you get your colonoscopy done, we can detect polyps, remove those, because polyps are precancerous lesions and they can develop into cancer, and then that spreads throughout the entire body.
Absolutely. What are some of the risk factors that are associated with colon cancer?
So some of the risk factors are going to be age. So at 45, we want everyone to get screened, both men and women. Family history of colon cancer. So having mom or dad or brother or sister having colon cancer, it's very important to get ahead of time. Sooner than later, your colonoscopy. And then if you personally have a history of polyps, then we want you in sooner than every 10 years. And then the last one's going to be lifestyle or dietary issues. So like eating lots of red meats, processed meats, a lot of smoking, alcohol abuse, those kind of things are going to increase your risk of developing colon cancer.
Oh, absolutely. Yeah. Many people under the age of 50 are getting diagnosed with colon cancer. What are some of the contributing factors? I'm assuming a lot of what you just said, and it's also happening a little bit earlier than 50 as well.
That's true, yeah. I think about 10 to 15% of especially rectal cancers were in the age under 50 in people. And so I think the environmental factors, the dietary that we touched on, as well as like sporadic gene mutations, is causing increased amount of polyps and colon cancer to happen in the younger population.
Well, that's why it's so important, one, to get these tests and to take care of your body in every single way. Early detection is crucial. Can you tell us about the screening and what those options are?
Yeah, for sure. So the most important and the best screening is going to be your colonoscopy, because you can visualize everything. If you see a polyp, remove it right away and then help prevent colon cancer. The other option is going to be your stool test. So the FIT test is going to detect blood in the stool, and if it's positive, then you definitely want to have a colonoscopy. There's another stool test called Cologuard. It also detects not only blood but also DNA, so it can detect your increased risk of colon cancer. It's a better sensitivity as well.
And if you're having symptoms, is it already too late? Or, because at 45, some people might be having symptoms prior. It's happening a little bit earlier. What is your best advice on that one?
That's true. Sometimes symptoms present with later types of colon cancer, so advanced stages. But if you are looking for symptoms, the ones you're going to look for is rectal bleeding, low blood counts or anemia, and then fatigue or weight loss. So those are some signs and symptoms of colon cancer.
Well, thank goodness there are options, and you guys are always there for everybody, every step of the way. Tell us, okay, so you kind of mentioned the home base. So you have the home base, and then you obviously have the one where they go into the hospital and take a quick nap.
Yeah, that's right too. Yeah, exactly. A colonoscopy is not as bad as people think. The preparation is liquid, but it is mixed with Gatorade, so you mainly taste the Gatorade, and then that's the toughest part for some patients, but most patients actually say it's not that bad. And then when you get to your colonoscopy, you actually have a good nap with the anesthesia, and then you're able to get your colonoscopy done, and in 20-30 minutes and recovery, you're out the door. So
yeah, I think it's just don't be intimidated by the test. Know that it's good to get it done early so that you guys can be there for them if you find anything.
Yeah, we're here to help, and we definitely want everyone to get their colonoscopy done. So definitely tell all your friends and family. So it's very important. It's very preventative to get this colonoscopy done to help prevent colon cancer.
Well, thank you so much for coming on the show. Thank you for bringing awareness to everyone and keeping everyone safe.
Yeah, thank you. Thank you for having me.
Absolutely.